first message is to the healthcare workers, as I would like to emphasize the importance of early detection and prompt referral. Once the child presents, it is very, very important that this child is properly evaluated and reviewed and promptly referred, as this has been proven to increase the prognosis of the disease. Once a child presents to the specialist early, they are promptly evaluated, adequately reviewed, and their treatment started early. And once the child starts treatment early, it helps to improve the outcome. The target is for the child to have an 80% chance of cure, and for most childhood cancers with good outcome, we implore healthcare workers to evaluate this child as early and as fast as they can, promptly refer this child so the child can get the best of care. Also, when parents present to the clinic, they have a whole bag of questions and they are confused. They want clarifications, they want answers to questions as they've never navigated this path before. So I would also implore the healthcare workers to explain this condition to the parents, let them know what the estimated treatment time is going to be and what it entails to care for a child with cancer, as this is very, 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 very important in the long-term outcome of the child and the prognosis. When a parent knows what's ahead of them, they are able to prepare adequately, financially, mentally, psychosocially, and get help when they can, because it's not just a one-man's job. Also, we encourage videos, leaflets that further explains this condition so the parents can know what the condition entails and how the treatment path or journey is going to be like. We also emphasize the importance of multidisciplinary care when it comes to treating a child with cancer, as it's not just an oncologist's business. Only an oncologist cannot take care of the child's oncology care, cannot take care of the child's endocrinology care, cannot take care of the child's psychological care, as these are also important factors that affect the prognosis in the long term. We encourage healthcare workers to invite other specialists in caring for this child, as it's not just a burden that an oncologist can carry alone. Focus majorly on the treatment phase of care. However, I would also like to emphasize the need for aftercare. When the child comes in, they've gone through their treatment phase and they're in the aftercare phase. They have questions, the parents also have questions on what should they do and shouldn't do for the child now that the child is done with the treatment. I would also like to emphasize the need for the doctor's availability to answering these questions and helping them create a post-treatment care path so the parents can know what to do after care and know where to go, what to do, who to approach. It is also very, very important for the healthcare givers to emphasize the need for follow-up treatment, as some of these malignancies do relapse. And if they are not aware that it is important to present to clinic for follow-up care, some of them are being lost to follow-up, and then there's a resurgence of disease and it is difficult to treat at the time. So I would like to emphasize that despite being done with treatment, it is also important to show up in clinic for follow-up care, for your scans, your blood work, physical evaluation, in order to pick up any warning signs early so it can also be appropriately treated. I would also like to emphasize the need for healthcare workers to also help spread the word, create more awareness for childhood cancer, and the need and importance for early detection and prompt referral. Thank you.